People ask me if other people have benefited from prolotherapy, and yeah, over our past 20 years doing this, yeah, that's what we keep offering it to people. What are some success stories? The most common one I tell people is a variety of really strange cases just to get them an idea of what's going on. So, a lady from Maldives came, she was having pain for 13 years. Much of this is related to her two divorces and having two different children from different men and now looking for love for the third time. We can't change that for her, but she did have very bad pain that was basically stemming from fibromyalgia. But it was so bad she'd just feel tired all the time. She couldn't do her housework, she couldn't take care of her two kids, much less look like someone who's looking for love the third time. Now, we had to do Prolo for her, and we had to give her about 150 to 200 injections. I can't remember properly anymore. But with that, she came back the next day and she was so happy. She brought her friends for the Prolo. That's an extreme case. But that's how many injections they could actually do. And when you address all these trigger points, people do get a sense of relief. Of course, once that's over, it's going to be diet, nutrition, hydration, exercise, but you can't talk about those things when a person is suffering. Another extreme case that's a success is a person who just had pain everywhere. We found out just the main areas where it was stemming from, which was mostly along the neck and the low back. So it was a different technique that we used for Prolo with this person. Just a few injections, all the pains out of here started to get much better. And of course we could put them on the lifestyle path to improve everything else. Like this for the past 20 years, we've been doing this over and over again, and the majority of people who get relief with just one injection is most common outcome. There are people who require multiple rounds of Prolo, and we warn them in advance, but it's hard to predict who's going to be what. Typically in a clinical encounter, there's a limited amount of time to make a decision. So once people tell us what their issue is, we start showing them options, and they can say if they don't want these things. If they don't, they get a particular path of care. If they do, and that path happens to be Prolo, then it's kind of hard to predict how they're going to respond. But always a good history can help us, and people aren't always ready to provide or willing to or able to until their pain is controlled. So people who require more than one Prolo injection often have lifestyle issues that are driving this pain. And this can make things better by getting a better history and then deciding how they get what regimen they get.